Veracity and Fidelity in Healthcare Ethics. Introduction. As we move beyond the four foundational principles of bioethics, autonomy, beneficence, non-maleficence, and justice, we come to two closely related virtues that bind them all together: veracity and fidelity. Veracity is truth-telling. It is the moral commitment to honesty in our words, transparency in our communication, and accuracy in what we share. Fidelity is keeping promises and commitments, remaining loyal to the trust patients place in us, and honoring the responsibilities we have undertaken as healthcare professionals. If the four main principles are the structure of bioethics, veracity and fidelity are the glue that holds that structure together. Without truth-telling, informed consent is meaningless. Without fidelity, patient trust collapses. And without trust, healthcare itself breaks down. 1. Why veracity matters in healthcare. In healthcare, truth-telling is foundational to every ethical relationship. Patients make decisions based on the information we provide. If that information is incomplete, misleading, or false, the patient's autonomy is undermined, and the trust between provider and patient is damaged. Example: a physician tells a patient their prognosis is good, when in fact the medical record states the condition is terminal. The intention might be to protect the patient from distress, but the result is a decision made in ignorance and an erosion of informed consent. Truth-telling in healthcare is not just about facts. It's about respecting the patient as a moral agent who has the right to know and understand their situation. 2. The link between veracity and autonomy, the patient's right to make their own healthcare decisions, depends on accurate, truthful information. Without veracity, autonomy is hollow. If a patient is deciding whether to undergo surgery, they must be told the exact nature of their condition, the expected benefits of surgery, the risks and potential complications, alternative treatments, including doing nothing. Failing to give full, truthful information is not a small omission. It's a direct violation of ethical duty. Discussion prompt. If a patient insists they don't want to know the details of their illness, is it still your ethical duty to provide them with full information, or can you respect their wish to remain uninformed? 3. Barriers to veracity in practice. Truth-telling is not always easy. In healthcare, there are real and perceived barriers. Fear of causing distress, worry that telling the truth will harm the patient emotionally, time pressure, feeling there's not enough time to explain the full picture. Cultural norms. In some cultures, bad news is softened or withheld altogether, especially by family members. Institutional policies, pressure from employers or insurers to limit disclosure. Healthcare professionals must navigate these barriers carefully. Withholding truth to protect a patient often creates more harm in the long run. 4. The role of cultural sensitivity. Truth-telling looks different in different cultural contexts. In some cultures, direct disclosure of a terminal diagnosis to the patient is considered harsh or even disrespectful. Instead, the family may want to manage the flow of information. In others, direct disclosure is a sign of respect and trust. Example: in some East Asian cultures, it is common for families to request that doctors speak to them, not the patient, about terminal diagnoses. In contrast, Western bioethics often insists that the patient be the primary recipient of all medical information. Discussion prompt. Should cultural norms ever override the duty to truth-tell directly to the patient? How do we respect culture without sacrificing veracity? 5. Truth-telling and hope. Some worry that telling the full truth removes hope, but veracity and hope are not mutually exclusive. Hope can be reframed. For a patient with a terminal illness, hope may shift from cure to comfort, from prolonging life to improving its quality. The key is to tell the truth compassionately, pairing honesty with empathy and helping the patient find meaning and hope even in difficult realities. 6. Fidelity. Loyalty to commitments. If veracity is about telling the truth, fidelity is about keeping your word. Fidelity means that once you commit to a patient, to a treatment plan, to a professional duty, you remain loyal to that commitment unless there is a compelling reason to change course. In healthcare, fidelity has multiple dimensions. To patients, honoring their trust and confidentiality. To colleagues, supporting team members and not undermining their work. To the profession, upholding the standards and ethics of your field. To society, acting in ways that serve the public good. 7. Fidelity and trust. Trust is fragile. Patients often arrive vulnerable, sick, scared, dependent on experts they barely know. Fidelity is what assures them, I can trust this person. They will keep my information private. They will act in my best interest. They will keep their word. Break fidelity and trust can be destroyed overnight. And when trust erodes, patients may avoid seeking care altogether, delay treatment, or hide critical information from providers. 8. Confidentiality. A core aspect of fidelity. One of the most visible forms of fidelity in healthcare is confidentiality. Patients share personal, often intimate details with their healthcare team. The ethical and legal commitment is to keep that information private unless the patient consents to sharing, or unless there is a serious and imminent threat to others. Example: breaking confidentiality to report a patient's intention to harm another person is generally justified, but sharing patient details casually in public spaces, even without names, violates fidelity and can erode trust. 9. Fidelity and professional boundaries. Fidelity also means respecting the boundaries of the professional relationship. Becoming too personally involved, making promises you cannot keep, or engaging in dual relationships that compromise objectivity can all undermine fidelity. Discussion prompt: if a long-term patient invites you to attend a deeply personal family event, should you accept? Does your presence strengthen the relationship or blur professional boundaries? 10. When veracity and fidelity are in tension. Sometimes truth-telling and loyalty seem to conflict. Consider a case where you discover a colleague has made a serious medical error that the patient is unaware of. Fidelity to your colleague might incline you to protect them. Fidelity to the patient and veracity demands disclosure. Ethically, the patient's right to know takes precedence because fidelity is ultimately about loyalty to the patient's well-being, not to professional convenience. 11. Strategies for practicing veracity and fidelity. To embody these principles in daily practice: be transparent, share information openly and clearly, document accurately, records should reflect the truth, not a softened version. Honor commitments. If you say you will follow up, follow up. Protect confidentiality. Limit information sharing to those who need to know. Address errors promptly. Disclose mistakes honestly with a plan to correct them. Use empathy in disclosure. Truth without compassion can be unnecessarily harmful. 12. Discussion scenarios. Scenario 1. A patient's adult children beg you not to tell their mother she has terminal cancer. What do you do? Scenario 2. You promised a patient you would personally call them with lab results, but you are leaving for vacation. Do you delegate or wait until you return? Scenario 3. You accidentally discover a colleague falsified part of a patient's chart to speed insurance approval. Do you report it? How do veracity and fidelity guide your choice? Closing reflection. Veracity and fidelity are the ethical threads that hold the fabric of healthcare together. Without truth-telling, there is no informed consent. Without fidelity, there is no trust. And without trust, healthcare becomes mechanical, transactional, and hollow. These principles remind us that ethics is not just about what we do, but how we do it, truthfully, loyally, and with integrity. As healthcare professionals, we carry the weight of people's trust. Every truthful conversation, every kept promise, every protected confidence strengthens that trust. And in the end, that trust is not just an ethical ideal, it is the foundation of healing itself.